Before, with my back and with my pain, there's no way I would have been able to take my kids to the park and like run around with them.
But now she can. Coming up today, the life-changing power of a spinal cord stimulator, intercepting the pain before it ever reaches the brain. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. We've all felt pain on some level, but chronic pain that doesn't go away after an injury or illness can rob people of quality of life. Sometimes pain can just be annoying. Other times it's agonizing. And today we're meeting a mom who says she's gotten parts of her life back after getting a spinal cord stimulator. But first, we're going to get to our morning rounds today. The first Monday of May is Melanoma Monday, devoted to preventing and screening for skin cancer. And if you're in the Kansas City area, you can get a free skin check today. I am joined by a medical oncologist specializing in melanoma, Dr. Gary Doolittle. Good morning, Dr. Doolittle. How are you?
Morning, Jessica. Doing great.
Good morning. Well, you are the medical director of the Masonic Cancer Alliance, which is co-hosting the free skin checks today. We are going to put a QR code there on the screen for us. It has the registration and the details. The event is happening this afternoon on our 39th and Rainbow campus. Dr. Doolittle, who needs a skin check, and how helpful are they in catching skin cancer early?
Yeah, that's a good question, Jessica. Being a skin cancer specialist, everyone needs a skin check, right? When you visit your primary care practitioner, either once a year or when you're in, it's always a good idea to get a total body skin check.
So anyone can get them, and
Absolutely.
Everyone should get them?
Absolutely.
And how often?
You know, at least annually, but it depends on your own history. If you've had a history of skin cancer of any type, the visits will probably be more frequently. If we're talking about prevention and trying to catch a cancer early, then typically we recommend at least an annual exam.
Okay, what are you looking for as a doctor on someone's skin?
Good question. Actually, it's the way doctors think. We look for the most difficult problems first and then work backwards. So we're really screening for skin cancers primarily, but then we can find benign conditions as well through the process. Okay,
if I have a spot I see, how do I know if it's concerning that I need to come see you?
Yeah, another really good question. A mole that is changing, that's getting bigger, that's bleeding, that's itchy is something that you'd really want to point out to your practitioner. But honestly, any skin spot that pops up that's new and different, if it's scaly, point those out too. More often than not, the patient finds the skin cancer before the doctor does.
You would have been proud of me. I was out in the sun yesterday, and I had all my long sleeves on, and I even had my sunscreen on underneath because I've got that fair skin, as you well know, because I've come to see you before. So the weather's great. As we know, there are more and more reasons to be out in the sun. When should we be wearing that sunscreen? What kind? How often should we be applying it?
Right. Pretty much anytime you're out in the sun, you need to protect yourself, right? Just proper sun safety. So that can include sunblock, SPF of 30 or higher, a block that covers both UVA and UVB rays, ultraviolet A or ultraviolet B radiation. From 10 to 4 for sure, after 4, before 10, oftentimes the intensity isn't as great, and it doesn't have the same impact. Apply regularly for sunblock. You know, this is an easy one for me. It's you want to pour out about a jigger full of sunblock and cover yourself with that to protect yourself from the skin.
Good
from
tip.
The sun.
Good to remember. What else? What other good tips do you have for us before we let you go?
You know, sunblock can be. It has its challenges, right? You have to remember to put it on. You have to put the proper amount on. So sun protective clothing, good way to go. Avoid the sun if you can. You know, I'm out at the lake a lot, but I seek the shade when I'm at the lake. I also like to be in the middle of the lake at 2 o'clock in the afternoon when the sun is at its worst, and that's where a hat, sunglasses, sun protective clothing, sunblock comes into play.
So be sun smart.
Exactly.
Dr. Doolittle, always good to see you.
It's a pleasure. Thank you.
Thank you. Thank you so much. Well, after several surgeries and all kinds of painkillers, Stevie Rose was skeptical anything could bring her relief.
I'll be totally honest with you, some days were really dark.
That's hard to tell now when looking at 34-year-old Stevie Rose, who's a mom to 11-year-old twins, a wife, and a vocal coach.
A-O-O-E-A-R-O-O.
So she has what many would consider a dream life.
Story, been there, done that.
But 20 years ago, that dream was nearly cut short.
It was a 90-mile-per-hour crash. It was a drunk driver. He actually blew past a stop sign onto the highway, crossed over 3 lanes, and then went into our lane, and it just, straight head-on crash.
Stevie survived the crash and pushed through the pain left by the accident, and later a diagnosis of a rare form of muscular dystrophy.
When your body doesn't allow you to do that, or you feel like your body won't even let you do something simple as going to the bathroom or getting up out of your bed, or you know what I'm saying, like stuff like that, it's really hard.
The pain and fatigue made working and caring for twins tough. Stevie endured numerous surgeries, years of over-the-counter medications and addictive opioids.
Hey, how's it going?
Until she found Dr. Usman Latif at the University of Kansas Health System, who offered a different option, a spinal cord stimulator.
You're young. You don't need to fuse your back. You don't need to have all these surgeries and all these medications and all this extra stuff because you're so young and you have so much life to live still.
The stimulator is surgically implanted and delivers impulses to the spinal cord, which reduces the pain patients feel. In Stevie's case, she felt nearly 100% pain relief.
Literally everything. I've been able to spend more time with my kids. I've had more energy. I've been able to make memories. I'm gonna cry because it literally has changed my life.
And we're so glad to have Stevie here in studio with us today, alongside her pain management specialist, Dr. Usman Latif. Thank you both for being here with us.
Yeah, thank you for having me.
Good to have you, Stevie. Just how are you feeling today?
I feel great, so much better. I have so much life in me and just really happy.
Years ago, if somebody said, how are you feeling today, you couldn't say that, right?
No, not at all.
Dr. Latif, I know you're certainly passionate about treating pain, about these spinal cord stimulators, but certainly by judging Stevie's outcome, so great to see how she's doing today, sitting here by her.
Yeah, I mean, I think it's really exciting. I think we often underestimate the impact of chronic pain on patients' lives. So when we have a therapy that has evidence and actually works in our hands, it is really exciting.
It's probably just amazing to see how people just start to live with pain. You don't realize it when you've been doing it for so long.
Yeah, I think the outcomes are the most important. It doesn't matter what's your pain score or these types of things. What really matters is what can you do in life, and if we can change that, then we're making progress.
Stevie, take us back to that car crash.
Yeah.
What kind of injuries did you have?
So the airbags were deployed, and I broke my bone in my face right here, my orbital bone. I had a lot of internal bleeding from the seat belt because, it saved my life. And my back, I didn't have a lot of, anything that was pinpointed at that time, but over time, that's kind of when I noticed something was wrong with my back after I had my kids and just the wear and tear of just life.
But at the time, you were a teenager.
I was.
You were
I was 16.
You were 16. You were an active teenager. You were doing your thing and very active in the theater and just busy, out doing life. How did you manage just that? How were you pushing through just back then?
Hour by hour, literally hour by hour, and just trying to take it slow and, not jump into anything that I wasn't totally ready for. Just trying to learn to listen to my body. So,
was being young, do you think have something to do with why she was able to manage pain back then? Just being that age?
Yeah, that could potentially be helpful. I think, the longer more we progress in life, the more signals are going on, the more things that wear and tear that our body's taken, and it's harder to bounce back.
So after an injury like that, Dr. Latif, how does pain become chronic over time? What is happening to our system inside that's just becoming chronic over time, over the years?
So, the purpose of pain is to protect us. So you reach out for a hot stove, you touch it, it hurts, you pull your hand back, you prevent your entire hand from getting burned. But then at some point that pain is supposed to go away, or you have surgery and it heals up. But then if the pain persists, there's a problem. Maybe you go and seek some care. But if the pain lasts greater than 3 months, it's considered chronic pain. And the way I like to think about it is, let's say you have a car alarm. When the threat approaches, it's supposed to go off. And when the threat clears, it should reset. But in some people, that alarm just keeps going off even though the threat is gone. And that's chronic pain.
I like the way you described that. What are common first lines of treatment for chronic pain related to an injury like what Stevie endured?
So, we use all kinds of non-opioid medications, anti-inflammatories, medications that might work on nerves. Physical therapy is very important, the passage of time. Sometimes we'll do things like targeted injections. So if there's a certain nerve or a certain area that's inflamed, then we can do steroid injections there. And then there are lots of other minimally invasive treatments that we can try. And the hope is that through the course of this treatment, patients will improve.
Stevie, let's talk about treatments over the years, because this is, because you're how old now?
So I'm 34.
Okay, so 16, now you're 34. Let's kind of take us through the journey of treatments over the years. Did you feel like at some point things were working and you kind of got into things and then you're like, okay, let's move on to something else? Kind of take us through that.
Yeah, kind of. So as I was figuring out different parts of my body and what was hurting, I did a lot of injections, steroid injections, so many different pain medications. I did PT and got other diagnoses along the way as well. I also have a rare form of muscular dystrophy, and so that also kind of is a factor in listening to my body and trying to figure out, okay, what is best for me. And so the surgeries that I've had 3 microdiscectomies. One of them was kind of an exploratory surgery because they couldn't figure out why I had all this nerve pain going down my legs. And so as I've come to know Dr. Latif, he's like, you're so young, you don't need all these surgeries. This is just, it's not really fixing the real issue at hand. And so that's when he, gave me that, confidence and that in going forward with the spinal cord stimulator.
So, but before you got to Dr. Latif,
yes.
Were you finding any relief with any of these things here and there? Did any of these surgeries maybe set her back? Were you finding that by the time she got to you, would you wish she would have found you sooner?
Yeah.
In some ways?
Yeah.
That's a tough question to answer. I would say that there's definitely a role for surgery. I mean, sometimes if there's something structurally that's going on, and if we can fix that in a way that is not harmful to the patient, then they can have a really great outcome. And we work really closely with our spine surgeons, and we've had lots of patients who have great outcomes. But I also think that you can sometimes reach a point where you've been through multiple revisions, and if you're not making progress with it, then maybe we need a different path.
Okay, so before she gets to you, she's still becoming a mom at this point. So how are you managing becoming a mom of twins at that? How did you get through I can't even imagine.
Yeah,
you're just enduring daily pain and trying to be a mom.
It's already hard to be a mom when you're feeling great. It's already hard. It's already a huge just responsibility, and I felt like I was a shell of a person. I wasn't myself. I wasn't happy. I wasn't being, the mom that I wanted to be for my children. And so dealing with that pain, I mean, it always takes a village to raise a baby, but then to raise twins, I definitely was very just blessed to have this community that just gathered around me. But there were days where I couldn't leave the house. Sometimes I couldn't even get off the couch. Sometimes I couldn't get out of bed just because the pain was so horrible. And, being a mom and just having that on the side, it's debilitating. And it's disheartening.
Before kids, were you able to work? Was there
I worked
issues
a
with
little
work?
bit, but I couldn't be on my feet for too long. I actually owned a salon at the time, and I was cutting hair, I was doing eyelash extensions, I was teaching, and just doing kind of a whole bunch of things. I'm sort of a Jackie of all trades. So
Jackie, I like that.
Yeah, and so it was hard. It was really hard to manage that pain, but also do all these things that I had all these dreams and aspirations and things I wanted to do with my life, and I couldn't do that. My body wouldn't allow me to.
You've been very candid though about talking about mental health.
Yep.
And I told you I'd give you a chance to talk a little bit about that because that's been a really important part of your story up until you met Dr. Latif, because that changed really the course of everything for you. But before that, because there's a lot of people going through what you're going through. I'm going to let you kind of talk a little bit about that, because the mental health aspect of this has been really important for you.
Oh yeah, absolutely. I think when you get into this position where, your body won't let you do these things and you are in a dark place, really. I've been in dark places a few times in my life, and I am 34 years old. And so when I was going through that, if I had a friend that said, hey, you know what, I've got a loaded gun, do you want me to put you out of your misery? I probably would have said yes, because It was so, I don't know, I felt like I was alone. I also felt like, well, why me? Kind of, I had a little pity party and just thought, why me? Why do I have all these issues, and what's the deal with it, you know? And I think that it's really important for people to know that you're not alone. And pain, everyone has pain in some, you know, way, of some level. And so we need to talk about it more, and we need to get this like stigma of mental health is something we don't talk about, and it's scary and it's weird. We need to talk about it, and we need to share with people like candidly how we're feeling. How are you really feeling, you know? And if you're in a dark place, how can I get you out of that dark place?
Thank you for sharing
Yeah.
that. And that brings us to something that got you out of that dark place, which
Yeah.
is the spinal cord stimulator. When did you hear about this as an option?
So I met Dr. Latif through my husband, actually. So we moved to Kansas City. He's doing residency at KU. And Dr. Latif was he was referred to me by my doctor and by my husband as well. Just heard all good things. And so I made my appointment with him, and he just was like, you know what, you're young and we don't need to do all these surgeries. We don't need to do all these things that you've done already, because they're not working. They're just not working. And so he's like, I think you're really going to be a great candidate for this spinal cord stimulator. And I was like, you know what? Everything else hasn't been working, so all right, let's do the dang thing. Let's get it done. Yeah.
Dr. Latif, how many people live with chronic pain? Do we know how many people might be a good candidate for the stimulator?
Yeah, so it's estimated that about 60 million people in the United States suffer from chronic pain. It's more prevalent than diabetes, depression, hypertension. It's one of the leading causes of disability in the country. We think that maybe about 10% of those patients, or about 6 million people, are probably eligible for a spinal cord stimulator, and that could be for like back and leg pain, failed back surgical syndrome, but it can even be for things like painful diabetic neuropathy. So there's a lot of applications for it. In any given year, we're probably only addressing 1% of that need. So there are a lot of people out there who probably could still benefit.
Well, explain how this works. We have an animation, and explain how the spinal cord stimulator treats the pain.
Yeah, so essentially, we talked about before, these are signals that are, when they're normal, they're really helpful. But sometimes you end up in this situation where you have these unhealthy pain signals that are going up towards your brain. And so what we do in this situation is we place this device that can modulate those signals. So essentially what it does is it turns down the volume on the unhealthy signals to your brain, so your brain can still process the real signals that you need to worry about. So it doesn't create numbness. You can still feel everything, just like you normally would. But we just get rid of that unhealthy pain signal. And then if you still do something that's not wise, like, oh, I'm going to move this really heavy sofa, your body's still going to tell you, hey, that's a bad idea.
Yeah.
Good to know. Good to know. Well, as we know, AI is everywhere, and it's right here, as we know. How does AI, how is it incorporated into this spine stimulator?
So I think that's actually been a huge advancement for the field. A lot of what goes on here, as you can imagine, is it's very complex. There's all these signals going up the spine, there's these little electrodes in there, and they're trying to modulate it. And so there's programming involved. It could be where on the spine should we activate it, how strong should that signal be, what kind of signal should we use. And that may be different for each individual, and also it may change over time. And so what that means is sometimes you have to come into the clinic and we have to make adjustments, then you have to go home and try out some of those things, then you might come back and make some more adjustments. So there's a lot of tinkering that goes into it. And what AI has done is straight out of the gate, it can figure out based on 100 million data points what is the best program to start you on that is most likely to just work straight out of the gate, and we might not even have to change it. And if things do change over time, it can just go ahead and give you new programs from the comfort of your home without you ever having to come in. And in fact, for Stevie, we have not had to ever manually change her program. She has been just purely managed by the AI part of it, and that's pretty amazing.
How's it been so far?
It's cool. It's really cool. Yeah, I can change it if I feel even just a slight pinch of pain here or there, or if I'm overdoing it maybe one day. I can go in on my app and I can say, okay, this is where I feel the pain, and the program just kind of works with my body, and for me, it's a medical miracle. So I can't be more happy about it.
Dr. Latif, you let us bring a camera into your OR. Thank you for that. What happens during the surgery itself?
Yeah, so it's a relatively minor surgery. It's a same-day surgery. You go home the same day. We make two small incisions. One is kind of just next to the spine, and one is kind of typically around the buttock area. we use tiny needles to place the electrodes into the spine. They go in the epidural space, which is kind of an open space behind the spinal cord. Once the leads are in the right spot, we get rid of those needles. We run those leads underneath the skin to the other incision, and there we connect them to a tiny battery that we then tuck into that other incision. And then we close up, everything's completely on the inside.
And this is one of the rare implants that you can kind of try before you buy. Can you explain the trial period and how it helps patients decide?
Yeah. No, I think that is one of the really cool things about this. I always tell my patients, I can't guarantee, any given thing we're going to do is going to work, but we're always going to do the thing that we think is most likely to help you. The thing that's unique about this one is that you can come in for a trial. For that trial, it just feels like you're getting an injection. We go in with 2 tiny little needles, we place these leads in there, we take the needles out, we tape everything in place, and you go home. And for a week, you just get to try it out. At the end of the week, we just tug on those 2 threads, they fall out, and we discard them, and then we say, okay, how'd you do? And if it helped you, very phenomenally, if it was very life-changing for you, then we can move on to the surgery and put in a permanent device. And if it didn't, then that's the end of that chapter, and we kind of move on to see what other options do we have.
Well, Stevie, we of course know the implant worked eventually for you, but
Yeah.
what did it feel like during that trial period?
There's a little bit of procedural pain. So at first I was kind of just like, skeptical. It's not going to work. It's not going to work. And then, I would say about by day 6, that's when I noticed I actually have a lot more energy than I've had in years. Way more energy, way less pain. And I was thrilled. I was so excited that it was actually working.
Talking with you, you said along with the pain, you said fatigue was a huge thing for you over these years.
Yes. Yeah, so that's actually one of my biggest symptoms with muscular dystrophy as well, is there's fatigue, feeling tired all the time, and just the immediate change, even over just those 7 days of the trial, I could not believe how much more vibrant I felt and how much more energy, and just not having that fatigue in the back of my mind every day. It was like a weight was lifted.
Dr. Latif, how often does someone do the trial but then decide not to do it permanently?
Yeah, so I think one of the most important things with any of the interventions or treatments that we have is making sure we're picking the right patients, the patients that are most likely to benefit. Generally, kind of the threshold for this treatment is that about 80% of patients who go to trial should go onto implant. And I know that our numbers here are closer to 90%. And so that basically tells us that we're doing a good job of picking the right people who have the highest likelihood of benefiting. But it also tells us that we are able to identify those where maybe it might not help them. And that's good, because we don't want them to get a permanent implant.
And then you find another option.
And then we work for other things. Yes.
Well, if you're watching live, you have a chance to ask your questions right here live. Please take advantage of our chat on YouTube or Facebook. You can also email the Medical News Network. That information is right there on your screen. Stevie, what was your surgery experience like? How quickly were you able to get home to your kids?
Oh, the same day. Yeah. It was so quick. I was able to go home and recover in my own bed. And yeah, it was great. It was comfortable. It was quick. No complaints.
Any specific situations where you really noticed a difference in your chronic pain? Were you like, oh, wow, I would not have been able to do that before?
Oh, yeah. I mean, just doing everyday life things, going on a walk with the dogs, and, spending more time with the kids and being a more present parent. Just that alone is such a huge change from how I was feeling before, and feeling, like, oh, I'm just not doing what I want to do with my kids and being a parent and all those things. And, it was such a change in such a positive way that I was like, yeah, this was the right thing to do. And I was so glad that we took that leap of faith and had that, doctor-patient, transparency. And so it really worked out for us in the end.
What do you feel, though? What is the feelings you do have? Is there any type of, you have to have some type of pain sensation?
Yeah, kind of. It's not really, it's almost like a little zing. Like I'll feel like just a tiny pinch or something, but then that's when I'll retake a test or something on my app with the spinal cord stimulator, and that's when the program, it just shifts, it pivots, and makes sure that the next day, if I'm doing something similar that I was doing the day before, it kind of modifies that. And so as time goes on, it actually, my pain level, it's almost, I would say I'm probably at 98% pain relief most days. So
is it battery powered? How do you recharge it?
Yeah, so it's kind of weird. My son calls me a robot, but I can't like plug myself into a wall or anything. But I have this like portable charger, and it's like a little plate, and I sit it up against where the battery is, and I just kind of let it charge about, I would say I can go about a couple weeks without charging it. I've actually forgotten about it before because my pain relief was so great. I've forgotten about it, and the battery actually went completely out, and that's when I was like, oh, I'm kind of starting to have those you know, pain triggers again. And so then I would charge it, but the plate goes up against the battery. It takes maybe, I don't know, I would say like 30-40 minutes tops. I can watch my favorite show, I can read my book, and I just kind of sit there and it charges.
What
So-
if somebody forgets to charge it? Dr. Lucci, for real?
Yeah, so if you forget to charge it, it's not really that big of a deal.
Okay.
It just means you'll probably notice that, hey, I'm kind of uncomfortable, and then you'll eventually figure out, hey, I forgot
You'll
to
figure it
charge
out.
this.
Yeah.
It might just take a little bit longer to charge it back up the very first time. The nice thing is, because the system has AI and because it has the app, it keeps track of that. So it'll let you know, hey, you need to charge this. The other nice thing is that it slowly reduces its power consumption over time based on your particular needs. And so even with Stevie, she's already kind of at a setting where she only probably needs to charge once a month, really. And eventually it could potentially bring it down to the point where she maybe only needs to charge it 6 times a year.
I want to get to some questions from our viewers this morning. And Jill wants to know, will Stevie always need the pain stimulator, or will there be a time when her body is reset and doesn't send the pain signal?
So I would say that's a great question, and it's hard to know for sure. I would say that you could fall on either side of this. So we have patients where they've had a stimulator and for a really long time, maybe a decade or two, and they still use it and they're doing great. Sometimes we have patients where they do actually come in and say, hey, I was using this, it was doing great. Now all these years have gone by. I actually kind of started using it less and less, and now I actually haven't used it for the last year, and I'm still doing great. And it's not completely understood how that works, but we see that also. And so sometimes they'll come in and say, hey, why don't you go ahead and take it out? Because I think it's, I don't think I'm going to need this anymore.
Angela has a question. How much have spinal cord stimulators changed in the past decade? And would a person ever need new leads?
Yeah, so there's been a lot of change. I'd say that the last decade in particular has seen so much difference. We used to have only stimulation where you actually felt it when it was on, and now we have stimulation such as what Stevie has, where it operates a different way, and so you don't really feel anything when it's on. All of the different companies that are out there have developed new technologies, new ways of stimulating the spine, new waveforms, all kinds of things like that. And also, everything's just gotten smaller and more convenient. The batteries are smaller, they last longer, everything is better. It can be possible sometimes that patients will come in and there's things that could improve. So like you have a stimulator but it's really old, and now we have all this new technology, and so maybe yours isn't really cutting it for you anymore. So maybe we could trial something new, and if it works, we could change it out. Changing the leads by itself, if they've moved, we might have to revise them or move them to where they need to be. Or if there's an issue with them, we might replace them. But usually the biggest upgrade comes from actually changing the battery device, because that's kind of the brains of it.
Well, Marsha wants to know, is there any risk of the stimulator device becoming dislodged from its placement in the body? And if so, is that common, and how could it be addressed?
Yeah. So the battery itself, because of the way it sits, it's really unlikely that it's going to move very substantially. Occasionally we have patients who come in and they've really put on a lot of weight because of the chronic pain, and then we get this working great, and then later they come in and they're like, oh, it's almost kind of shifted a little bit because I lost 100 pounds because now I'm feeling great and I'm active and that's good. But in terms of the leads, the most common thing would be sometimes we'll have somebody they're like, oh, I slipped on some ice and I wrenched my back or something happened, and then we might get an X-ray and say, oh, okay, the leads have moved a little bit. It's less common for them to move after 6 weeks. After 6 weeks, they usually stay put. But if something like that happens, if they move enough that it makes a difference, we might have to revise it. But because of the way that we position them, a lot of times there's enough leeway that even with that, we'll just say, okay, we'll just kind of adjust the programs and we're still good to go.
Last question is from Jeremy. He wants to know, Stevie, can you feel the stimulation when it happens? And if so, what does it feel like?
I don't no. I think it just feels like I'm young and spry again. I don't know.
It doesn't feel good.
I don't really feel anything. No, it's almost like he took my pain away and that's it.
And here you are.
Yeah.
Doing well.
Yeah.
What do you want the big takeaway from your story to be?
I think the biggest takeaway is you're not alone, and we all have some level of pain, and if you have tried all these different avenues and it hasn't worked for you, don't knock it till you try it, because this spinal cord stimulator really has changed my life. I've gotten my life back. I feel so much better, happier. I feel like I can go and conquer the world, and it's been so life-changing, and I honestly think that if this even helps one person, it'll be worth it to share my story, and hopefully people have more I guess that feeling of, I need to figure out if this is right for me, and if it is, like, that's amazing. I really hope that it helps at least one person.
Well, thank you.
Yeah,
for just
thank you for having
being
me.
so open and sharing your story. And we're just glad you're
course.
doing so well. Dr. Lateef, what's the big takeaway today?
I think Stevie made such great points here today. But what I would say is think of it even more broadly. If you're out there and you're suffering with pain and you're not making progress, maybe spinal cord stimulation could be for you. But also there's so many other advances that we've had in the last decade. So regardless of what your pain is or where in your body is, come and see us and come see our group. And there are so many different things that we could potentially offer. And I'd love to make an impact in more people's lives.
Thank you both for being with us today. Appreciate you both. Thanks to our viewers for being with us. Thanks for your great questions, and we'll see you back here tomorrow.
Living with terminal brain cancer. Join a candid conversation with a father, husband, surgeon, and now patient. I'm Alexis Del Cid. On the next Morning Medical Update, the treatments that are giving Doug Burton more time with family, plus his message to anyone touched by cancer, Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stein's podcast. Now, everywhere podcasts are available.